And good morning, I'm Dr. Deuk, CEO and founder of the Deuk Spine Institute. I'm here with one of my patients who traveled from California with a problem in his neck. He's been having pain, it radiates down into his left arm. He has some other issues as well, like pinched nerves in the elbow and palm, which he's treating in California. But the herniated discs at 5, 6, 6, 7, we did the Deuk laser disc repair yesterday. You can see me going in with the endoscope and the laser. It's all done with a 4mm incision, bloodless surgery, and outpatient. And here he is less than 24 hours later, and he wants to share his story with you. So go ahead.
Okay, so the first thing I want to do is give Dr. Deuk a joke that I wrote last night. He's going to understand this. We might have to look some of these things up. A neurosurgeon was performing several radiofrequency ablations on patients when he started hearing loud shouts and screams in the recovery room. Shocked, he walked into the room to see what happened. The nurse ran up to him. "Doctor, things got pretty heated up for a while, but no one had the nerve to say anything." That one over there seems especially nerveless. All right, so I got him to laugh.
I like
Good stuff. Okay.
I like it.
You know, just a
Nerveless
little
instead of
dad
nervous.
humor there. Good
I
stuff.
love it. I love it. I love it.
What happened for me was ever since I was a kid, I was the young kid that fell off the high chair when I was 2 years old, fell down the staircase when I was 4, got tripped, hit the back of the sandbox at 6. I went in the military, I parachuted out of planes, hit my head more than once with a Kevlar helmet, then served in the military wearing Kevlar helmets, sometimes banging my head against heavy artillery pieces. Sometimes I didn't have my helmet on. Sometimes just the weight of the helmet was hurting my neck and my back.
That part about banging your head in the plane against heavy artillery pieces, sometimes you hear in the military like a helicopter went down, right? Suddenly exploded, went down. Now I know why.
Well, you know, I mean, people will say, why would you jump out of a perfectly normal airplane?
Right?
But, you know, let me just tell you, low contour flying by sea, some of the jets there makes things a little bit tough. And then after that, what I started to notice, I started to develop where my muscles in the back just became really severely tense and stressed out. I kind of thought it was work and otherwise. And then when I'd go to things like the dentist and I'd lean my head back, my entire left arm would just start tingling and sparks shooting out like crazy. And when I got back up, things were better. But then I went on a trip back in early May, and then it was happening all the time. At that point, I got an MRI done. You know, obviously at that point, I went to my primary care and I had options. There were 5 options really, if you think about it. One was do nothing, just, hey, I'm getting older, just deal with it. You know, stop being a baby and just, you know, life goes on. Number 2, maybe seek physical therapy or chiropractic care, which I did, and it helped. For some things, I had really bad posture. That was one of my issues, but it wasn't taking away the problems that I was having with the tingling doc. So then I started to seek out medical expertise in Los Angeles. First choice was full disc replacement for both of the discs. The way I was thinking about disc replacement was, it's kind of like having a car. The tires are halfway worn down. You're having problems with one of the tires in the back, and you decide to replace it with a bigger tire that's different tread, different braking system. Now, it's gonna work if you're riding on a regular road or highway, but it's something different and that's working there, and it was never made for the car.
You'd be replacing it not with a different tire, but a metal tire.
Yeah, a metal tire, even worse,
like
exactly.
a tank tread.
Yeah, and then you can't do MRIs, or you gotta find the ceramic one, which you can't. Okay, so that was disc replacement. That didn't sound attractive. ACDF, I've got some dear friends that have done ACDF. Problem there was, I was thinking of that same car analogy. Now you got the rear tires are locked in. They only go straight, they brake at the same time, the suspensions are the same, and only the front 2 are moving around. And I was worried about what is the effect on the disc above and below. And my mom had this problem. She had lumbar fusion with rods in her back, and then she ended up having lumbar fusion in the upper ones when she was alive, and that poor woman went through a lot of pain for it. So I was figuring, hey, look, I'm a guy that works in technology. There's got to be a better solution to this. And I just started doing research online. There's got to be someone. And I was very grateful that I came across Deuk Spine Clinic. I must have watched about 15 of his videos. I started to watch some of the procedures before I started freaking out, just looking at that stuff, just not my thing. I'll stay in technology. But one of the things I found immediately that endeared me to me, Dr. Deuk, was the people that sat in this chair. You could just see what he was doing and how he was helping them. And I knew I'd found the right person that could help me. It was that easy, Doc.
Awesome.
You know?
Well, you persevered. You were uncompromising. You wouldn't settle for what you were being told which is, let's go in and put metal in your neck. And we've talked about this. You're aware that there's a big problem in spine with the industry that produces metal pushing these implants on the patients through the surgeons. The surgeons are the ones that recommend it, and the surgeons are rewarded financially in several ways for doing that. Problem is, it is not the best treatment. It used to be the best treatment, but now we've made progress. We do the laser surgery. That is the best treatment, and you've had it. I told you before surgery, it may not work because you got some bone spurs, but you told me this morning that you don't have that pain anymore.
Yeah, I do not. And I can't even describe it because it's a sort of an ease that I haven't had probably for more than 10 years, Doc, at least. I don't even know how long I've been dealing with these, and again, the electroshock and everything else. It's been a blessing, and I'm certainly having you take care of me. And I'll tell you what, Doc, one of the things I'm going to try to do is see, what can we do with the government? I mean, it doesn't matter what side of the aisle you're on, but maybe there's ways to talk to folks in the government to get more attention to these kinds of things. Because what I'm afraid of, I found you because I looked really hard and I did all the research. There's a lot of wonderful people out there that they just don't know. They're really limited on their options.
Of course. The problem is the absolute truth, which people don't want to hear, is the government is controlled by big business.
Yeah.
And there is no business in the world bigger than insurance companies. They are the most powerful. They've brought the pharmaceutical industry to its knees. They brought the medical industry to its knees. And the insurance companies just sit in the back. They take your money every month with premium payments, and then they don't pay their bills. And they keep the money and then become richer and richer and more powerful. The insurance companies do not want my surgeries out there because they work and they know what's going to happen. Everybody is going to want it. And that is going to be like, what do you call it? A run on the...
Yeah, run on the market kind of thing. Exactly.
Yeah, everyone's going to want it. They're going to get all these bills and they're going to have to pay them, and it's going to be in the center of attention. All these people are going to be complaining they're not paying the bills. Insurance companies do not want new technologies that work. They want patients to only have old technology that doesn't work, that they're afraid of, because there's nothing better for an insurance company than a patient who's scared to have a medical treatment. The patient won't get it done. There won't be a bill for the insurance company to pay. They get to keep the money, and they don't have to be the bad guy denying payment.
Yeah, and Doc, you were saying also that overseas folks have embraced technologies like what you're able to provide, right?
That's correct. Yeah, if you go to China, India, Korea, they don't do much fusion. They do mostly endoscopic surgery because it's better. And in the United States, there's only probably 5 surgeons in the whole United States that do true endoscopic surgery. Some of them advertise it, but they don't actually do it. A lot that needs to happen. We're probably 30 to 50 years ahead of the rest of the spine surgeons out there in terms of treating spine issues that are degenerative and joint issues that are degenerative. But I appreciate you sharing your perspective.
Thanks, Doc. Appreciate it.
Thank you
so
sir.
much.
Congratulations.
All right, appreciate it. Thank you.